Welcome to Medscape's weekly brief on recent medical news and findings. Hello, I'm Dr. Arifa Kassaboy, a practicing internist and a medical editor for Medscape and WebMD. If your weight loss patients complain that their appetite grows as their waistline shrinks, they're probably right. A study presented at Obesity Week 2016 found just that. The 52-week placebo-controlled trial included around 150 patients with diabetes treated with canagliflozin. This SGLT2 inhibitor lowers blood glucose by causing excretion of glucose in the urine, which results in weight loss. But for every kilogram lost, patients consumed an extra 100 calories a day. Previous research has shown that metabolism slows when patients lose weight. But these new results quantify the feedback loop between energy intake, driven by an increase in appetite, and expenditure. This may explain why so many patients who are trying to lose weight experience weight plateaus and weight regain. The study reinforces that we need more effective appetite control strategies. Next, new guidelines from the American College of Physicians for the treatment of gout are garnering some major criticism. Previous guidelines, including those from the American College of Rheumatology, recommend routine monitoring of serum uric acid levels. However, ACP argues that evidence for routine monitoring is unclear, pointing out that patients with higher serum urate levels may still be asymptomatic, and some may even have acute flares below the threshold. ACP also points to a lack of evidence that outcomes are better when treating to one serum uric acid level versus another. They recommend managing gout with pharmacologic therapies that include urate lowering and anti-inflammatory medications. They also state that long-term uric acid lowering therapy should not be initiated after a first gout attack or in patients with 2 or fewer attacks per year. There are experts who disagree. They believe that the ACP guideline views gout as an intermittent acute disease rather than a progressive chronic condition requiring regular care. This major disagreement in the basic long-term management of gout leaves us wondering, what indeed is best for the patient with gout? We'll have to wait and see. And finally, the number of Americans with compromised immune systems appears to be growing, and this has very real implications for the ability to stop the spread of disease. A new analysis from the 2013 National Health Interview Survey was presented at ID Week 2016. It found that about 4% of U.S. adults reported being told by their doctors at some point that their immune systems were weakened. And almost 3% of those asked reported current immunosuppression. The survey population included people living with HIV, those who had undergone a transplant, those with autoimmune conditions, and individuals who are immunocompromised because of medications like steroids. Rates were higher in whites, women, and those 50 to 59 years of age. This should be a wake-up call to all of us about this under-recognized phenomenon. These patients are at risk for opportunistic infections as well as reactivation of chronic infections, and they may be unable to receive certain routine vaccines. You'll find links to each of the stories we've included in today's news brief and the transcript listed below. For Medscape and WebMD, I'm Dr. Arifa Kassaboy.